Clinical Psychology Chapter 12 Psychodynamic Perspective. Anal stage. The psychosexual stage that extends from about 6 months to 3 years, during which the child focuses on defecation and urination. Analysis of dreams. A psychoanalytic technique that attempts to shed light on unconscious material. Because dreams are regarded as heavy laden with unconscious wishes in symbolic form, the analysis of dreams is believed to provide important clues to these wishes. Brief psychotherapy. Psychotherapy of relatively brief duration that has grown in popularity due, in large part, to the cost containment measures imposed by healthcare systems. Death instincts. The innate drives that are responsible for all of the negative or destructive aspects of behavior. Defense mechanisms. Strategies used by the ego to stave off threats originating internally from one's id or superego. Ego, the organized rational component of the personality. The ego uses perception, learning, planning, and so forth to satisfy the needs of the organism while at the same time preserving its place in the world. Ego analysis, an alternative to traditional psychoanalysis that is characterized by relative de-emphasis on the role of the unconscious and the exploration of childhood experience, and relative emphasis on the adaptive functions of the ego and the exploration of contemporary problems in living. Fixation, the defense mechanism that occurs when the frustration and anxiety of the next psychosexual stage causes the individual to be arrested at his or her current level of psychosexual development. Free association, a cardinal rule of psychoanalysis in which patients are regarded to say anything that comes to mind. Over time, free association is believed to shed light on unconscious thoughts and urges. Genital stage, the psychosexual stage that follows the onset of adolescence and ideally accumulates in a mature expression of sexuality. Id, the deep, inaccessible portion of the personality that contains the instinctual urges. The id is without order, logic, or morals and operates solely to gratify the instinctual urges. Insight. In psychoanalytic psychotherapy, a complete understanding of the unconscious detriments of one's irrational and problematic thoughts, feelings, or behaviors. Interpersonal psychotherapy. A brief, insight-oriented therapy that is psychodynamic in tone. It has been applied primarily to the treatment of depression and is considered an empirically supported treatment. Interpretation, a method in which the psychoanalyst reveals the unconscious meanings of the patient's thoughts and behaviors, thus helping the patient to achieve insight. It is the cornerstone of nearly every form of dynamic psychotherapy. Latency stage, the psychosexual stage that extends from 5 to 12 years of age, during which the child is characterized by a lack of overt sexual activity. Latent content, the symbolic meaning of a dream's events. Life instincts, the innate drives that are responsible for all of the positive or continuous, or I'm not sure what I have written there, so just positive aspects of behavior. Manifest content, what actually happens during a dream. Moral anxiety, anxiety that arises from the concern that a person will act in a way that conflicts with the standards of his or her conscience. Neurotic anxiety, anxiety that stems from the fear that a person's id impulses will be expressed unchecked, thus resulting in trouble. Oedipus complex. I think we all know what that is. If not, that is not for me to say. Oral stage, the psychosexual stage spanning about the first year of life, during which the mouth is the chief source of pleasure. Usually this is by sticking your fingers in them, sucking on them, or probably just eating food. Phallic stage. I'm going to skip that. It's fairly obvious, as well as the oral stage. Pleasure principle. The rule of conduct by which one seeks pleasure and avoids pain. The id operates to this, by the way. Primary process. The internal and impulsive type of thinking that characterizes the id. Sorry, not internal, it's the irrational. Sorry. Projection. The defense mechanism that occurs when a person attributes his or her unconscious feelings to someone else. Psychic determinism. A major assumption of Freudian theory that holds that everything one does has meaning and is goal-directed. Psychosexual stages. A series of developmental stages posited by Freud, each of which is marked by the involvement of a particular androgynous zone of the body. Reaction formation. The defense mechanism that occurs when an unconscious impulse is consciously expressed by its behavioral opposite. Sounds confusing. Reality anxiety. Anxiety that arises from the presence of a real danger in the outside world. Reality principle. The rule of conduct by which one defers the gratification of instinctual urges until a suitable object and mode of satisfaction are discovered. The ego operates according to this principle. Regression. The defense mechanism that occurs when excessive frustration causes a person to return to a stage that once provided a great deal of gratification. Repression. The most basic defense mechanism serves to keep highly threatening sexual or aggressive material out of consciousness is awareness, often involuntary. Put it all in the books, lock it up, and throw away the key, I say. Resistance. Any attempts by the patient to ward off the therapist's efforts to dissolve his or her neurotic methods for reasoning problems. Any client action or behavior that prevents insight or prevents bringing unconscious material into consciousness. Secondary process. The rational and self-preservation type of thinking that characterizes the ego. Superego. The component of the personality that represents the ideals and views of society as they are conveyed to the child through the words and deeds of his or her parents or role models. The role of the superego is to block unacceptable id impulses and to pressure the ego to serve the ends of morality rather than those of expediency. Talking cure. Discovered by Breuer, I can't pronounce their name. The use of techniques that encourage patient talking as a way to address and alleviate neurotic symptoms. Therapeutic alliance. The bond between patient and therapist. A strong therapeutic alliance is believed to contribute significantly to a positive therapeutic outcome. Transference, a key phenomenon in psychoanalytic therapy in which the patient reacts to the therapist as if the therapist represents an important figure for the patient's past. Unconscious, the portion of the mind that is not accessible to awareness. Unconscious motivation, motivation that resides outside conscious awareness. Walking through process, a careful and repeated examination of how one's conflicts and defenses have operated in many areas of one's life. That is the conclusion of Chapter 12, Psychodynamic Perspective, Key Terms and Definitions. Thank you for listening.